If you go shopping, it's easy to figure out how much you're going to spend. While you're standing there looking at the item you want to buy, you can do a quick estimate on what you'll pay, because the price tag is right in front of your face. If you really want, you can even open the calculator up on your phone and figure out the exact total yourself, including tax. Wouldn't it be nice if healthcare was like this? Unfortunately, it isn't so black and white. We choose healthcare services because we need them, usually at any expense. But this is difficult when it comes time to pay. When you get your statement, the reality of how expensive your services are finally sets in. It's even worse if your insurance company doesn't cover some of these services like you were expecting. If patients don't have any idea of what they owe, then they might not have a way to pay for it. And when they don't pay, it causes issues for both the patient and provider. Hi everyone, I'm Matt Moneypenny, and today I'm going to explain 6 tools that are changing price transparency in healthcare. But before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. And while you're down there, you might as well hit that alert bell icon next to it so that when we post new helpful content, you get notified. Before diving into the tools, let me explain the current price transparency landscape to you. As of 2019, hospitals are required to post standard prices online that are accessible to patients. These are viewable within what's called a charge master. Now, a charge master is a list of billable items that the hospital provides. The goal with this new rule is to make prices known to patients so they could shop for their services to ease the burden of healthcare costs. But these large lists are confusing with their many medical codes and abbreviations. It's difficult for patients to piece together the charges of each service that they'll need so they can calculate an estimate. They usually don't know every service that their visits will involve, making it impossible to calculate before their appointments. This is why many organizations are developing more distinct tools that make it easier to understand costs. So let's go over some of these tools. First up, we have New York Governor Andrew Cuomo's proposal. He plans to launch a price transparency tool that makes it easier to compare costs and quality of procedures across the state. It will even include resources such as how to handle a surprise bill and options for financial help. Price doesn't always affect quality in healthcare, which is why this tool will include the quality of services. It's counterproductive if patients choose a service based on price if it ends up being low quality. But by knowing the quality, consumers can make better decisions when they need their care. The state of Florida launched its own method, Florida Health Price Finder. This service finds procedures with the state and includes price breakdowns by county, state, and national averages. The third tool is Health Score CT, a Connecticut-based website. This also includes quality ratings for medical providers. The estimate compares costs about 46 procedures and currently only includes information for those with commercial insurance plans. The goal of the site is to give power back to the health consumers and also help patients start their discussions with their providers and insurance companies about costs. Since this tool doesn't factor in deductibles, copay, or car insurance, it can't substitute talking to doctors and insurance companies altogether. Rather, it's a starting point for understanding prices and should help begin the conversation about procedure costs. Next up, we have Sutter Health. The North Carolina health system recently developed a tool that goes even further. The healthcare provider contacts the patient's insurance to determine outpatient service costs. The practice then creates a personalized, real-time estimate before the patient needs the service. So far, patients who have used this tool said they feel satisfied with their experience. Our 5th price transparency tool on our list is Snek Medical Center Estimator. With this tool, patients enter their insurance information and choose their procedure. It then calculates an estimate based on patient-specific information, such as if they've met their insurance deductible. It's functional for most major insurance companies. Sometimes, things happen during a procedure that affects the final cost. The estimate includes a reference number so patients can bring the information to their procedure. This way, hospitals can compare the actual cost to the estimate and explain to the patient why it's different. This tool again helps start the conversation with providers. Some organizations are also implementing transparency for medications, not only for services. This is beneficial since medications are already shoppable products, unlike medical procedures. This leads us to our next tool on our list. RxReview and Cerner Corporation formed an agreement to integrate prescription pricing solutions into electronic health records. This provides coverage information earlier. Providers can view costs within the Cerner EHR so that they can review financial information before prescription. It allows them to ensure the cost is affordable for the patient. Providers can also access patient benefit information to make appropriate alternatives. While healthcare isn't immediately transitioning to a perfect system, price transparency is a good step to alleviating some of the issues with high medical costs. There's still some confusion about services, but these tools are opening up conversations about procedures and their costs. But until a majority of systems create these tools, there's no easy or accurate way to compare prices. As more organizations develop price transparency tools, patients can have better options to service their costs. For more information on price transparency, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.